Hello there, this is Dr. Mintz. This is a discussion, very brief, about pulmonary vascular congestion, also sometimes called pulmonary vascular redistribution. It's very difficult to appreciate what that actually looks like unless you have the same patient baseline normal chest along with the abnormal chest. That's what I have here. So this is a point in which the patient's upper lobes, and all you see is the upper lobes. You can tell that the heart is big just based on how wide it is at this point, and it's going to be wider than that below there. But if you look in the upper lobes closely and you follow these little lines here, thin lines, here's one vessel, but it branches pretty quickly. So out in this area, you don't really see even continuous lines. Maybe there's one there, very thin. And here is at another time when the patient was experiencing some failure. And you can see there's 1, 2, 3, and maybe another branching linear structure on the right. And even more conspicuous is on the left, where you see 1, 2, 3, 4, maybe 5 pulmonary vessels, which I argue you could barely see before. And it is not simply a matter of technique. There probably are some differences in technique, but the overall increased attenuation in the lungs here largely reflects the increased prominence of the pulmonary vessels, and probably a component of interstitial edema too. It's early, but if you see this little ring here, and you see this thickening of the walls of the bronchus there, and of a small bronchiole here, and then you look back for the same things here, you see this bronchus here, but you don't really see thickening of the walls. So this is the normal baseline appearance of this patient, and this is how it looks when the patient was developing failure. So keep in mind, the reason these upper lobe vessels become distended is that the patient spends a lot of their time upright, and so these will be the vessels to distend last in the case of congestive failure. Congestive heart failure, of course, is going to cause an increase in back pressure in the pulmonary veins that are trying to drain into the left atrium. So as that pressure increases, you will see more and more distension of the upper lobe pulmonary veins. Remember, these are converging on the left atrium where they want to drain. If that pressure is too high, they will get distended. So this is that patient in failure, and this is that patient normally. So first time I've been able to actually grab the same study on the patient and compare the first chest radiograph with the radiograph showing failure. So I hope this illustrates it well. This is the normal we're looking at now. Here you see pulmonary vascular redistribution, meaning that the prominent pulmonary veins are more in the upper lobes than they are in the baseline, more normal setting. I hope that helps.